MRI, magnetic resonance imaging. So what is MRI scan? What is MRI scan? An MRI or magnetic resonance imaging is one of the technique which we can say diagnostic radiology technique. We can call it as diagnostic radiology technique that uses magnetism and magnetism, radio waves, and a computer. Required that means here for this that magnetism, radio waves, and a computer. Okay, set for what? To produce images of body components. So what is the outcome? We'll get images of body components. So magnetic resonance imaging required magnetism, radio waves, and a computer. Okay. Then that important to note that MRI does not use ionizing radiation as we have seen in the previous two cases, X-ray and CT scan. We used ionizing radiation, but like X-ray, like CT scan, here there is no ionizing radiation. So MRI does not use ionizing radiation as involved in X-rays and CT scan, and that's why we can say MRI is generally a very safe procedure in compare with the CT scan. MRI is a very safe procedure. Okay, so it's a non-invasive, we can say now, because we are not using the ionizing radiation. We are not sending the radioactive rays through the body like CT scan, like X-ray. We can say it as a non-invasive, a medical imaging technique, non-invasive medical imaging technique that helps physicians to diagnose certain anatomical abnormalities. Certain anatomical abnormalities are pathological condition. Anatomical abnormalities and pathological condition easily recognizable by MRI, and it is a non-invasive technique. That non-invasive medical imaging technique, not like X-ray and CT scan. So this technique uses, so mechanism we came through now. The technique uses nuclear magnetic resonance of protons to generate proton density images of the body parts. So this is the line that if you understand the sentence, that you came to understand the total, the MRI. Magnetic resonance imaging uses powerful magnetic field and radio frequency pulses and a computer to produce the detailed picture of organs, soft tissues, bones, virtually all other internal body structures. So let us try to find out that particular line. So what is it exactly? Where MRI focus exactly? Magnetic resonance imaging, MRI, focus particularly the protons of the hydrogen atoms of the body. Let us learn the mechanism and let the correlate that particular issue in the text back again. Protons of the hydrogen atoms of water. The word to be remembered. The magnetic resonance imaging focus on protons of hydrogen atoms of water. Protons of hydrogen atoms of water. Okay, so what is these protons of hydrogen atoms of water? Where do they present in our body? So that we need to find out. Protons of the hydrogen atoms of water, we need to find out. Okay, let us find out. Where do you see? If you see the cell contains cytoplasm, isn't it? Any cell of the body we are talking about, the cytoplasm. Cytoplasm contains water, isn't it? So we are talking about that water. In the body cell, in the tissue, in the organ, in the tissue, in the cell, in cytoplasm, will find some water, isn't it? So that water, so now you just correlate protons of the hydrogen atoms of the water. That's it. We are talking about that only. That is, we are talking about the protons of hydrogen atoms of water. How do they present in the body? That is very important. So just how do they present in the body? They are present like this. Like we are comparing this with the children in the ground before the prayer. That means in the playing time, that how they are present like this. Okay, so the protons of the hydrogen atoms of the water of the body in the cytoplasm, they are present like this. So Just imagine. I'm taking only now the protons of the hydrogen atoms of the water of the body. So like this, these are the arrangement here. They are present like this, the protons of hydrogen atoms of water. Okay, so what we do then? What we do then? So we place this particular patient, we are going to place in a certain bed. I'll show you the bed. So this is a kind of bed. You may have seen over so many times. So even we went to the diagnosis center, that these kind of machines you are already watched in many movies, isn't it? So this kind of bed. So what is present here? That in this kind of bed, a strong magnetic field is present here. Okay, it's a strong magnetic field. So we are talking about a strong magnetic field. The patient is placed in the bed where we create a strong magnetic field. So for what? To make the protons of the hydrogen atoms of the water align in one direction. Now the children in the ground, like when prayer is going on. Okay, so I think I'm not maintaining linear order. Let's maintain. So like this, children maintaining a rope. That the technical word, what do you say? When we create a strong magnetic field, protons. How do the protons of hydrogen atoms are present in normal condition? I said like this. So they are aligned in this particular. That means in scattered way they are present. In general, in the cell, in the cytoplasm, that containing water containing hydrogen atoms of the proton atoms of the hydrogen. Okay. So now, when we created a strong magnetic field, they are going to align in one direction. This is a word to be remembered. They are going to align in one direction. So what I am saying here, they are going to align in one direction. Okay. So this is the first thing which happens. Okay. Next, what we do? The second magnetic field we create, the another magnetic field we create with radioactive frequency. The second magnetic field we are creating with radioactive pulse. Okay, RF pulse basic. The second magnetic field we are creating here. For what? Here that to align to that attain the small amount of radioactive pulse, so that every that proton will take some absorb some radioactive frequency. Okay, so that little amount of radioactive frequency there'll be. It is just like what we are saying. If you take a iron rod with the help of magnet, that if you rub that iron rod, what happens if you rub the iron rod with the help of a magnet? What happens? So for a period of time, this particular iron rod is also act like a magnet, isn't it? In the same way, so we are giving the weak RF pulse, weak radioactive frequency pulse we are giving to this particular protons of hydrogen atom in the whole aligned in one direction. So let me say once again, first magnetic field is created here for what? To make the protons of the hydrogen atom who are present like this, who are present like this, we aligned in one direction. Okay, so next what we are doing, the second magnetic field is created here, second magnetic field which gives that little radioactive frequency pulse they give. Then after we withdraw the second radioactive frequency pulse. Okay, so we withdraw the second magnetic field, but every proton will take some amount of radioactive weak pulse. So that we are going to record on that as an image, MRI image, magnetic resonance image. Okay, let's try to understand these particular lines in the textbook. Then after we'll get back here that this is the mechanism to be remembered over. So let me go for the mechanism. The MRI scanner and procedure. MRI scanner is a giant circular magnetic tube. The patient is placed on a movable bed that is inserted into the magnet. The patient is placed on a movable bed that is inserted into the magnet. So that I shown to you that particular bed. Human body is mainly composed of water molecules which contain two hydrogen nuclei or protons each. The magnet creates a strong magnetic field that makes these protons, a strong magnetic field that makes these protons align with the direction of the magnetic field. Protons in general not aligned under normal condition. They are not aligned in one direction in normal condition. Okay, next, what we are doing, that is the first point to be remembered. A second radio frequency electromagnetic field is then turned on for a brief period. The protons absorb some energy from these radio waves. When the second radio frequency emitting field is turned off, the protons release energy at a radio frequency which can be detected by the MRI scanner. The protons return to their equilibrium state from the energized state at different relaxation rates. That will be recorded. Okay, so that means that whenever we stop the second magnetic field, that whatever the energized protons are going to be reaching to their equilibrium state from the energized state at different relaxation rate. Okay, so mechanism. So even you understand the mechanism, that you just feel so some incompleteness, that because of so what we come to know in this particular area. So do remember, this is the work of doctors. Okay, simply what we can say here, if you know the normal condition, for example, this is a normal condition, this is humerus, the upper one, and this is the radius ulna, this is the joint. If you know at least, that's why I'm going through this. Okay, radius ulna and joint, so this is the bone. So when we are taking the x-ray or MRI or CT scan, whatever, so a crack is appeared here, that you observed a crack. Okay, small crack we observed there. So we know the normal condition. That's why we able to recognize this kind of abnormality. Got my point here? So that here some pieces, fragments or pieces are observed. In normal condition, we don't find that pieces, isn't it? So that means some breakdown is happened that we can recognize. Okay, some breakdown I am observing. So that means here in this particular cases, you should know what is exactly normal. So then after we'll find, okay, for example, I'll give an example here, not necessary for MRI scanning to identify, but I'll give an example here. For example, a particular organ, we are taking an MRI, okay. In that, the generally cells are present like this, For example, there is a cancer. So when they present like this, we'll get some MRI picture. Okay, but imagine the whatever the picture we got here, that something else we got here. So imagine in that particular organ or a tissue is going with the tumors are developed here. The minute tumors are developed, and the cells in that area are much densely arranged. So definitely you will get some kind of that image which is normal than the different. You will find it or not. So normal way I'm saying here, with this you don't become doctor and you don't become radiologist here. So that kind can be observed easily. So that means in case of MRI, what is the advantage here? Even a small tumor is developed, that because we are checking that every cell level, isn't it? Cell level in the cytoplasm, the protons of the hydrogen atoms of the water. At that level we are checking. That's why we can see the health of each and every cell or tissue of the body. So that is an important thing here. So let me say once again, 2 points to be remembered from this paragraph. One is a strong magnetic field is created. A strong magnetic field is created, which that particular magnetic field, what it will do, that aligns all the protons of the hydrogen atom in one direction. What we are saying here, in normal condition, this kind of alignment is not there. Okay. A second radio frequency is created here. The second radio frequency electromagnetic field is then turned on for a brief period. The protons absorb some energy from these radio waves. The protons, which are aligned in one direction, they absorb some energy. Okay. So then after we'll switch off that particular, that for a brief period we said. When second radio frequency is turned off, the protons are releasing energy. These protons are going to release energy at a radio frequency which can be detected by the MRI scanner. MRI scanner which identify that particular energy which is liberated from the protons of the hydrogen atoms of the water after switching off the second magnetic field. Okay, what is for first magnetic field? To align them in one direction, to make them in linear and one direction. Okay, So what is the second magnetic field, second radio frequency electromagnetic field? That is to give some energy for the from these radio waves. When the second radio frequency emitting field is turned off, the protons release energy radio frequency which can be detected by the MRI scanner. Okay, so this is MRI scanner, procedure of MRI scanner. Only thing to be remembered over 2 points. One is first magnetic field, what it do, and second magnetic field, what it do. What happens after the switching of the second magnetic field? That's it. These 3 points, if you remember. The main is going to be two. There are two magnetic fields that you have to remember. Second is a radio frequency electromagnetic field that for a brief period will arm. Okay. So that's it about the MRI scanner and their procedure. So different types of tissues emit different quanta of energy. So it's clear that every cell of proton of hydrogen atoms of water is going to release some energy after switching of the second radio frequency electromagnetic field. Then different types of tissues emit different quanta of energy in the form of different wavelengths and different rates. So abnormal tissues definitely that such as tumors can be detected because of the protons in different types of tissues return to their equilibrium state at different rates. Every tissue, every cell is having their own returning procedure towards the equilibrium state. So that's why that we can recognize abnormal tissues easily. Okay, then tissues such as bones with less water content, because water is less in that particular bones, we can say protons are also less. Okay, they look different in MRI image. The bones look different in MRI image. Accordingly, there is a contrast between the images of different tissues based on their water content. That means the tissue is having their own quantity of water, isn't it? Even in the case of same tissue, normal healthy cells and pathological cells emit different energy waves. That we are going to recognize and that we are going to record in MRI. MRI is said to be very accurate and exact. What is going to happen inside the body will find out easily through the MRI. Okay. Hence, the difference in the images of the different types of cells that you can see. So that's it about magnetic resonance imaging. Okay, let's take a look at the photograph here. This is MRI scanner. That is MRI scanner. And for what it is used for? The information received is processed by a computer and an image is generated. The image and resolution produced by the MRI is quite detailed and can detect tiny changes of the structures within the body. For some procedures, radio contrast agents like gadolinium are used to increase the accuracy and resolution of the images. After the scanning is completed, the computer generated images we call tomographs, images of the thin slices of the body parts can be transferred to a film, hard copy that you may have seen over that kind of hard copies. A radiologist interprets, very important. You see here, we are not here to identify. After learning X-ray, CT scan, and MRI, don't do overaction. I know this. I already learned this. So that don't do overaction. I'll explain what is happened. Don't do like that. That they a qualified professional required. A radiologist interprets the images of the body parts and gives his diagnostic opinion. Okay, next, let's go through the MRI is used to distinguish pathological tissues such as brain tumors. Particularly, it is very good for brain tumors from normal tissue. It can recognize. MRI can show even hairline fractures of the pelvis, the hip region that may not be detected by a traditional X-ray or CT scan. Where the things are not possible in the X-ray and CT scan, MRI can make that possible. Okay, ballooning of blood vessels called aneurysms easily can be detected by MRI. Aneurysm may occur when a tear begins in the layers of the walls of aorta or arteries or veins in the parts of the heart. That aneurysms easily can be recognized by MRI. Moreover, MRI is preferred to CT scan. MRI is preferred compared with the CT scan. Why? That we said CT scan means multiple X-rays, isn't it? The CT scan involves effects of ionizing radiation, whereas MRI does not have much ionizing radiation. Okay. So that's it about the MRI, magnetic resonance imaging. The first thing, mechanism you have to remember, and the second thing, that where it is going to be used over. Okay, so that we have some small box item that we'll read that also. MRI provides a good contrast between the different soft tissues of the body, which makes it especially useful in imaging brain. It is very good to identify the brain tumors, muscles, heart, and cancerous tissues compared to other medical imaging techniques like CT scan and X-rays. MRI is the best source, what you can see. Okay, so it where it depends on, it depends on that particular mechanism of protons of hydrogen atoms of the water. That is very important to be remembered. Okay, so what protons of the hydrogen atoms of the water do? The protons of the hydrogen atoms of the water do. Generally they are in scattered direction. Generally they are going to be in scattered direction. When we make the particular strong magnetic field, when we create a strong magnetic field, that particular strong magnetic field which makes the protons to align in one direction. That is the first point to be remembered. Protons of the hydrogen atoms of the water will be aligned in one direction. Then next, second magnetic field with radio frequency pulse will give, that gives some radio frequency energy to the protons of the hydrogen atoms of the water, which they are going to absorb. Okay, so when we withdraw that particular second magnetic field, the switched off, that protons are going to release the energy in different levels. These are the 2 points to be remembered. Okay, after that, that thing is going to be recorded in the image. Okay, so now let's watch this particular scenario in an animation. He is the founder actually.
If you take, let's say, a human being and put him in one of these big, very homogeneous magnetic field magnets, then there's a tendency of that magnetic field to line up the magnetic moments of the nuclei, the spin of the nuclei, and the hydrogen in your body, which is in your muscle and your blood. Now put on a radio frequency pulse, say 60 megahertz or something like that. Then you can make this magnetization of your hydrogen nuclei. You can turn it 90 degrees away from the direction of the magnetic field. Your magnetic moment will precess. If you have coils around, pickup coils, it will induce a signal. If I want to see where the signal is coming from in your body, I put on another magnetic field on top of the very homogeneous one. It's called a magnetic field gradient. By that I mean it makes the field stronger in one place and weaker in another place. What you do in order to actually get the image that you want, or the fine resolution that you need, is you put on magnetic field gradients of different strengths, a series of pulses. That's why if you get an MRI machine, you hear boom, boom, boom. It's all these pulses that we're putting on with different strengths of magnetic field, perhaps even different directions, because we want to get a three-dimensional picture of you. You record all of these data, and when you finish, you can now use what's called Fourier transform. It's a mathematical technique. You can work back to how strong the signal was in each of these voxels. And so this is how the image is developed.
So that's it. Nothing to remember more here. That as I said to you, it's a 4 marks question. 2 issues you have to remember. Okay, 2 issues. One is how it works, and second, where we use. Third, if you remember that, you can write what are the benefits of this particular MRI. Okay, so just remember that particular concept. So these kind of questions are going to be when you are reading you feel so you'll be able to write, but when you start writing in examination, that you don't find how to write and what to write for these kind of general questions. So that's why I'm saying you make your own map. The first, I'll write some introduction. What is MRI? Then how it is better than the particular other, and where it depends. That means on what basis. Means CT scan. What on what basis? Multiple X-rays like MRI. MRI on what basis? That magnetic field. That create the magnetic field. We create the magnetic field. So likewise. So if you remember in that particular way, that MRI will be used. That good enough you can write an examination. Okay. So that's it about MRI, magnetic resonance imaging. MRI, magnetic resonance imaging. And then we'll move on with the next part, that ECG, electrocardiogram.